Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Obsessive compulsive disorder, we are looking at the highlights. So what are the key points here? The key point is, let's look at MC. It is the most common obsession. What's the most common obsession? Obsession will be of contamination. Next will be the order of compulsion. So order of compulsion will be checking. It will be checking as well as cleaning. Then we have the treatment. So in treatment, there is exposure and response prevention. There will be exposure as well as response prevention. And it is the first line. This will be the first line. Then comes the CBT, there is a cognitive behavioral therapy, and CBT along with the ERP, CRP and the ERP. Next is a pharmacotherapy. Next is we have the DOC. DOC means a drug of choice and it has a very high dose of the SSRI. So high dose of SSRI, this will be the drug of choice. The treatment in case of the non-responsive patients. So in case of NR patients, we administer the clomipramine. So non-responsive, this clomipramine is given, and or the antipsychotic augmentation. So clomipramine is given or the antipsychotic augmentation. Next is we look at the treatment of severe or refractory cases. The treatment of the severe or the refractory cases. So in this case, there will be a deep brain stimulation which will be seen. So there will be a deep brain stimulation will be done. To learn and grow daily like this, please do subscribe.